People with irregular heart beating or atrial fibrillation have a risk of developing clots inside the heart, and in patients with atrial fibrillation, these clots develop 90% of the times. I'm telling the wrong message. So, okay. Patients with irregular heart beating or atrial fibrillation are at risk of developing clots inside the heart. These clots, 90% of the time, develop in a particular structure called the left atrial appendage. This portion of the heart is minimally used in our cardiac function. Patients with irregular heart beating or atrial fibrillation are at risk of developing clots inside the heart, and 90% of the time these clots develop in a structure called the left atrial appendage. This is the reason why patients with irregular heart beating are put on blood thinners, because if the blood is thinned enough, then there is no or very low risk of developing any clot. However, there is a lot of people who, for multiple reasons, cannot receive blood thinners, and they have complications or they have failed many of these therapies. So in these situations, the treatment becomes very cumbersome. We have developed a technology to prevent these clots from forming by eliminating the left atrial appendage with minimally invasive techniques. These techniques may consist of either going around the heart and snaring the left atrial appendage, which is, as the name says, an appendage that sticks outside of it. We snare and we deploy a suture. By tying the suture up, we eliminate the appendage. Nothing is taken out of the body, nothing is inserted inside the body. Everything is done from around or outside of it. The other technique is by going inside the heart and deploying a plug in that left atrial appendage structure. And this is called the Occlusion treatment. And this therapy is being done currently with a couple of devices that are in an investigational phase. One of them is getting very close to be freely marketed for a clinical use.